Jones. My name is Heather and I'll be your nurse today. How are you doing?
Good, thank you.
Good. We have orders from the doctor to go ahead and do a dressing change today.
Okay.
Before we do that, and actually before I wash my hands, I'm going to match. Can you tell me your name and birthday and I'll match it with your wristband? 6/18/55, Clorinda Jones. Awesome. Thank you. Now I'll wash my hands. How are you feeling today? Okay, good. So how long have you had your central line?
I think about a year now.
Okay. How's that going? Have you had any problems with it? Any major infection or anything
Not
like
yet,
that?
thank goodness, not
Okay,
yet.
well, we're going to keep it that way.
Good.
So today our orders state that we have to change your dressing, which that's something we're going to do once a week. Every time you have like a lab draw or anything done, or if it's dirty.
Okay.
Okay, so those are the 3 times we're going to change it. And then we also are going to pull some labs today. The doctor has some blood cultures that he wants to see. And then we are going to change your cap just because we're drawing blood out of it.
Okay.
So what are the 3 times that we're going to change your dressing?
When it's dirty or soiled, when every 7 days, or when there's blood draw.
Perfect. You're my best student. All right, we're just going to put on some protective gear here because we're dealing with blood. And then we will get started. We'll do your dressing change first. And that part of the procedure is sterile. So that's why I'm putting this stuff on, and that's why I gave you that mask. And then we will do your lab work and stuff after that.
Okay.
So this first pair of gloves I'm putting on is just clean gloves while we take off your old dressing and get our stuff ready. If I can get them on. Are you having any pain today?
Nope, not today.
Okay. And do you have any allergies that you know of?
Nope.
Okay, and you're not allergic to heparin?
Nope.
All right. Heparin is the medication that we're going to flush through your cap after we're done. So now we're going to take this off, this old dressing. And I'm just going to loosen it first with this alcohol wipe. Just makes it a little easier to pull off. I'm going to remove your dressing, always moving towards the insertion site. And we're going to do our best not to disturb the line. As I'm taking it off, I'm going to be looking for any signs of infection. And taking note of what I see. Is there any redness or anything? Because those things could be indications of an infection starting. Have you had any pain at your site?
No, I haven't felt any today.
Okay. This is looking really good. It looks really clean. Always pulling towards the site. And we'll inspect the dressing. It looks good. So now we're going to toss that. We're going to do some hand hygiene. And we're going to start with the sterile part of our procedure.
Okay.
So for the sterile portion of the procedure, I'm going to have you turn away if you have to cough or anything like that. I'm just going to open this package, and there's another package inside. So those are my gloves. First I'm going to go ahead and open my sterile kit and I'll put my gloves on. Okay, so if you need to cough or anything, turn away. Please don't touch the site. I think you know that.
Yeah, I've done this quite a few times.
Yeah, you've been through this a few times. Okay, I'm just gonna open that and then put on my gloves. Can you see?
Mm-hmm.
Okay. Well, that one's a little sticky. Okay. Put on my left-hand glove first. Oh, got my fingers a little twisted up. So we're gonna put this one on, and then I'll fix them. So you can see with my hand, I'm just touching the inside of the glove, and then with my hand that's already sterile, I put my fingers inside the cup. Okay. So that one is good. I gotta fix this bad boy. Okay, that one is completely backwards, so we're gonna try again with the gloves. Toss those. And do that again. This paper just wants to float up on me today. Okay. That's much smoother. Okay, so there we go. I'm gonna get rid of this because I don't need it. And then we will keep going. So I already have a mask on, and so do you. We already have some gloves. I'm going to use this to extend my sterile field, but I'm going to move this over first. Okay. So now we are going to clean your site. Put your dressing on there for you. And now we're going to clean your site. So at this point, I'm going to grab your line so this hand is no longer sterile. And then we are going to scrub. We're going to scrub all the way around the site. This is called chlorhexidine, and it is very good at doing its job of cleaning stuff up and keeping it nice and sterile for us. As sterile as people can be. So we're going to clean your chest really well, and then I'm going to clean your line. We're going to clean all the way up it and underneath it. And just make sure that everything is nice and clean for you. Okay, so that part is done. I'm going to go ahead and get my dressing here. And we're going to put that over your site. Okay. So now that your dressing is on, the sterile part of our procedure is done. Because this is covered, and this is what we're worried about. So, ideally I would have a little bit of a bigger loop in your line. But we are gonna go ahead and take off this outer edge. but there's this little tab on here. It's tape, and it lets me write on there the date and the time that I changed your dressing. And it also has a place for me to put my initials so that they know who did it and when. So that they know when it's time for the next dressing change. Does that make sense?
Yes, it does.
All right. This border really likes this dressing. There we go. Okay. How does that feel?
Feels good.
Okay. So I'm just going to write my stuff on here. Date, time, and initials. And then we'll clean this area up a little bit. Change my gloves. And then we will go ahead and pull your labs and do your cap change. So we're all done with that stuff. Wash my hands again. Okay. So before we do anything else, we are going to clean the cap that's on your line. We just want everything to stay really clean. I'm going to put my gloves on. Oh shoot. Okay. So gloves on. All right, and now we're going to clean it for you. Open our little swab. And I'm going to make sure and scrub this for at least 15 seconds. Okay. And now we're going to flush your line with just some normal saline. We're going to do 10 mils, and we're just going to make sure that it's patent. So, that's all flushed already, no bubbles in it. We'll unclamp your line, and we're going to flush with positive pressure. That basically means push and then let go. Okay. Any pain or discomfort when I flush your line?
Nope, not at all.
Good deal, that's what I like to hear. So that is nice and open for us. We are going to draw out 5 mils of blood now. Unclamp again. And we're going to toss this one. Since we just flushed with our saline, we want to make sure we get a good sample here. So, now this next one is what we will send to lab. So first I'm going to scrub your hub again, since I put it down. Attach that, and then unclamp our line. And this is the 5 mils that we will send to lab. Clamp your line again. Now we're gonna put a needle on this guy. So we can put it in our fancy little container. All right. So we get there, it's coming right out. And on this vial, I'm gonna make sure your name and your birthday are on there. And the initials of myself, and then the date and time that we pulled the sample. Let it pull it all out. Okay, we're going to cap this needle, and put it in our sharps container, and this will go to lab. Okay, so we'll send that off to lab. Now we're going to clean your hub again, and we're going to change your cap. So we're going to change your cap because we drew blood out of it, and we don't want that blood that we put through there to cause any clots or anything. So we'll clean that, we'll remove, make sure our line is clamped, and it is. Remove this old cap, and then make sure there's no dry blood or anything that we can see. Put on this new cap, and it's pre-flushed, which means that there's fluid all the way through it. We can't have any air go into your line. And then we have 10 mils of just normal saline that we're going to flush, again using positive pressure to make sure that your line's still flushing good after your dressing change. Now we're going to pull off the thing and leave the syringe. Now we're going to flush with 5 mils of heparin. So heparin is, again, an anticoagulant or a blood thinner, and it is going to make sure that we don't have any clots in your line.
Good. I don't want no clots.
Nope, clots are bad.
Yes, they are.
So what are we using the heparin for?
So that I don't have any blood clots.
Yep. Okay, so that flushed really nicely, all 5 mils of it.
Good.
And now we're all set. I'm going to go ahead and take off this old tape for you, and we will put some new on. Get that ready a second. And then we'll be all set. Okay. So there's some new tape. Make sure your line is clamped, which it is. Do you have any questions for me, Mrs. Jones?
No, not at the moment.
Okay, and still not having any pain?
Nope, no pain.
Good, I'm glad to hear it. Okay, make sure we toss all of that stuff. Okay, so we're all done with that part. I'm going to clean up all my trash and we'll get out of your way here, okay?
All right.
All right, thank you so much for your time.
Thank you.